I don't have any official numbers on deaths. I know that there was an announcement by, I think, the Minister of Information on the 19th. I would imagine it's more.
Good morning. I'm Camille Williams from Radio Jamaica / Television Jamaica. Minister and the other members of staff who are here, I visited Santa Cruz yesterday and we tried to get to Black River, couldn't get there. But when we stopped in Santa Cruz off the main road, we went to the New River District and we also spoke with the St. Elizabeth Infirmary. One of the issues that is present in New River and I suppose other places is the issue of persons who have died or dead animals. When we were trying to get into New River, animals had died and their bodies, decomposed bodies, are on the roads in water. And people have been walking and traversing in those waters. Do you have anything to say, advice, anything, any caution? Well, not just Minister, anyone else in the room. Do you have anything to say to persons who are in places where there are reports of dead bodies, whether in buildings or on the roads or dead animals? That's one question. And two, do we have an idea now of the possible or current official death toll? Last number that we heard was 19. And I spoke with the funeral director and he didn't want to go on record, but it seems that there are far more out there than we can get to. So one, death toll. Two, any advice regarding dead bodies?
Right. So I had mentioned the environmental health team and the leads are in this room. You can speak to them after. But it's a very important part of the response, and that's the mode we're in now. Having secured some communication, having cleared some of the roadways, and now have the mobility to go into communities, we can now target particular areas while we work with the authorities, the other agencies, to secure other areas. So the team would be on the lookout for what you have just mentioned. So dead animals, for example, proper disposal of those carcasses. Clearly, if it's the worst of a dead body, then there is a mechanism for that. When I was in Westmoreland at the hospital, they were taking in a few bodies, and some of them were marooned in communities. So it took a little while to access them, and you wouldn't have known until someone raised the alarm that this was the case because of the nature of the accessibility and so on. Once access and notification was given, the JDF would provide the level of support that we can provide, air support, but then we also have arrangements with different entities to pick up and to drop off and so on. And I did witness at least 3 or so when I was at SAV. There were also persons who are injured, who, one man who broke his leg and was at home for like 3 days because he couldn't get access, and he came in while I was there. But the environmental health team, numbering 600 in an ideal scenario, would be out there, and we would want a kind of feedback on that if persons see, as you have just indicated. I don't know if anybody else wants to comment further on that, but that's my understanding of how it works, right? And we have to be vigilant, and it has to involve all of us, okay? I don't have any official numbers on deaths. I know that there was an announcement by, I think, the Minister of Information on the 19th. I would imagine it's more, but it wouldn't be wise for me to speculate because, and I say so because there are still places that we have had difficulties reaching. I know the storm entered the border of Westmoreland and St. Elizabeth. Communities like Darlington and those areas, Black River, of course, they were really impacted by the wind. A lot of roof damage, a lot of injuries, which we are now seeing coming in. We hope for the best, but we have to prepare, plan, and do the necessary reconnaissance to determine on that. So I'm sure the Minister of Information, once she gets an updated report from the police, will provide that information.
Dr. Tufton also announced that a fully equipped field hospital will be established in Black River within the coming week, supported by JDF soldiers and US Army helicopters transporting medical cargo.
These are very large lift helicopters, up to 11,000 pounds they can carry, and they're going to be working shoulder to shoulder with the JDF to get supplies out to the Jamaican people who we know are in desperate need. And we'll be right there with you.
I want to thank the government of the United States of America and of course the U.S. Embassy here in Jamaica for the coordination. I want to thank all of the personnel that have come. This is 3 of 8. We are hoping that by tomorrow the balance will be here, if not latest the weekend. And of course these 3 will be out to work tomorrow morning, I've been assured.
The facility will include an operating theatre and emergency units to replace the destroyed Black River Hospital. On the issue of volunteer coordination, the minister said a solidarity clean-up exercise will begin with health staff and family members, later expanding to the public once proper coordination is ensured. He also outlined plans for mental health support, including additional hotlines, on-the-ground counselling in the 5 worst-hit parishes, and the arrival of international mental health specialists on Monday. He assured citizens that relief distribution will be fair and non-partisan, emphasising that every Jamaican in need will be served.
Please remember to subscribe to our channel, your channel, Jamaica Whoop, like the video and comment below, hit the notification bell for more updates. Thank you and bless up.